Hi, I'm Rob Burke with Infusion Development. We're here at the eHealth conference in Vancouver 2010. We're here as a Microsoft partner and we're showing our solution that was built using Microsoft Surface. So let me show you how this works. Imagine this is the scene here. We're in a doctor's office. It's a clinical setting and I'm a physician. So I have my card and I can log into the solution using my card. So I just put it down on top of the Surface. And it logs me in as a doctor, Dr. Fred Banting. Good doctor name. And as I log in, now all of my patients show up here on the side, and I can scroll through them. And if I wanted to, I could access their medical records using TELUS HealthSpace. So HealthSpace is a system that lets us access our medical records, and it provides a unified source of medical information. Now where this gets really interesting from the Microsoft Surface perspective is that if we have a patient here, I can also log in the patient by putting their card down onto the table. So I'm going to put down Iris's card. Iris is actually pregnant. She's coming in to see me about an ultrasound she had recently. So now that Iris's card and my card are on the table, what I can do is I can pull up all the different information related to Iris's medical record. So something like an x-ray that we took a couple of years ago, I can look at, Iris and I can discuss. And the other thing that I can do is I can send it into her health card. And what that has the effect of doing is that now, if Iris is to log into HealthSpace, she can find a copy of that x-ray within her HealthSpace records. So essentially I've shared it with her. So in addition to images, some of the things I can also show are things like her medical records, something like about her heart rate. In this case it's an MRI that was taken a couple of years ago. So with the MRI, and let me just move the card so you can see, I could go through this image by image, or I can choose a frame rate. I can just run the entire thing through as a video. So that's maybe not something that I'd share with Iris in a clinical setting, but what I might do is for something like medication, I might want to be able to take out information about her medication, explain to her what it does, and then be able to send it to her so she can look up more information when she gets back home. Because what we're hearing at the conference is that a lot more people, physicians are seeing a lot more people are self-medicating. They're going to the web, they're looking up information themselves. And so while we have them in a clinical setting, we want to give them as much information as we can, make that interaction as valuable as possible, and then give them a really good starting point so that when they get home, they can look up more information. So to give you an example of that, she's coming in and she's pregnant. So one thing that she might be experiencing is issues with her circulatory system. So I'm going to pull out a piece of information regarding circulatory conditions that are related to pregnancy. And I can look through this, look at all this information regarding the condition. And then if I want to, I can also send that on so that Iris can look that up when she gets home. While she's here as well, we have this 3D view of the body. So I can bring this down so you can see. It has all the different systems here. And I can dial through all the different systems. And in this case, we're going to go to circulatory system. And then we have a 3D model that I can use when I'm describing this to Iris. So I can move the body around in 3D and give her more information that might help her understand the condition.